Hi everybody, welcome back to another exciting episode of Crash Course. Today we're zeroing in on a medication that's making waves in the world of cardiovascular health, Ticagrelor, otherwise known as Brilinta. I'm Shawn, pretty much a younger, less iconic Hank Green, and in the next few minutes we'll break down the essentials of what Ticagrelor is, why it matters, and how it's used today. So sit back, relax, and grab some snacks because Crash Course is here. For starters, Ticagrelor is a powerhouse in the realm of antiplatelet drugs. It's a game changer when it comes to preventing blood clots and maintaining heart health. Ticagrelor itself is a novel antiplatelet agent that has a faster onset of action than clopidogrel, its older counterpart, and produces high level of platelet inhibition with minimal interpatient variability. Now let's talk about why doctors prescribe Ticagrelor. Its primary indication is preventing cardiovascular events, especially in patients with acute coronary syndrome or ACS. It's sort of like the Superman of blood thinners, being stronger and faster than its alternatives, fighting against the forces that can lead to heart attacks and strokes. Furthermore, another indication is for primary prevention in stable coronary artery disease, or CAD, and high-risk ESCVD patients. Brilinta is also indicated for minor ischemic strokes or high-risk transient ischemic attacks. Lastly, Ticagrelor has an off-label indication being used in percutaneous coronary interventions for stable ischemic heart disease. So stick around, grab a notebook, and get comfortable, and let's embark on this educational journey together. We're about to decode Ticagrelor, from its mechanism of action to the nitty-gritty of the science behind the drug, including its chemical structure, potential benefits or side effects, and why it's considered a groundbreaking option in cardiovascular care. Melissa, take it away.
Ticagrelor works by inhibiting a protein called the P2Y12 receptor on platelet cells. Without it present, ADP binds to the P2Y12 receptor, which makes platelets clump together, and that can form a clot. Now, let's see what happens when we add Ticagrelor. By blocking this receptor, Ticagrelor prevents the formation of blood clots, which reduces the risk of cardiovascular events. Ticagrelor is what's called a reversible inhibitor, meaning that once it leaves the body, ADP is free to bind the P2Y12 receptor again, and then clots can begin to form again. For this reason, it's really important that patients are dosed correctly and that they take their medications as indicated and as dosed by their doctor. Now, let's talk about how Ticagrelor moves throughout the body. Its pharmacokinetics. Ticagrelor is administered orally and is rapidly absorbed in the gastrointestinal tract. Unlike some other drugs, Ticagrelor does not require metabolic activation, so it's ready to work right after being absorbed. After absorption, Ticagrelor is distributed throughout the body. Interestingly, it has a high bioavailability, meaning that a large percentage of the drug reaches the bloodstream and is available for action. It's mostly bound to a protein in the blood called albumin, which helps Ticagrelor navigate the bloodstream. Ticagrelor is also unique in that it doesn't require hepatic metabolism. It undergoes minimal hepatic biotransformation. However, it inhibits an enzyme called CYP3A4, which can cause drug interactions and can be dangerous. Now, let's talk about how Ticagrelor is eliminated from the body. Ticagrelor and its metabolites are primarily eliminated through the liver and kidneys. The drug has a relatively short half-life, which allows for its flexibility in use and adjustment when needed. Next, let's go back to Shawn to learn a little about dosing.
Understanding the right dose is key to safely administering this medication. So we'll unravel the dosing regimen so you can navigate it like a pro. Ticagrelor is typically administered as a loading dose, being 180 milligrams, followed by a maintenance dose. This maintenance dose is commonly seen as an oral dosage form. Usually the oral dosage form is 90 milligrams and is taken by mouth twice daily for close to a year after an ACS event. For CAD treatment, though, it is in a 60 milligram oral formulation taken by mouth twice daily instead of the 90 milligrams. After this, patients are usually taken off and then just put on aspirin. Lastly, Brilinta is contraindicated for the use in pediatric patients.
Hi, I'm Carly, and I'm going to be talking about Ticagrelor's adverse effects, contraindications, and precautions. While Ticagrelor is effective in many cases, it also has potential side effects that patients and healthcare professionals should be aware of. First, some of the more common adverse effects include dyspnea, which is a shortness of breath, as well as nausea and dizziness. Next, there are some more serious side effects that may require medical attention. One of the most significant concerns is an increased risk of bleeding, which can manifest as nosebleeds, prolonged bleeding from cuts, or even fatal bleeds. Also, individuals may experience bradyarrhythmias, such as ventricular pause or atrioventricular block. Finally, some individuals may have some more severe respiratory effects, including sleep apnea and Cheyne-Stokes respiration, an abnormal breathing pattern. It is important to be aware of these potential adverse effects and to discuss any symptoms or concerns with a healthcare provider. Let's also touch on some contraindications and precautions. Contraindications are situations where use of ticagrelor should be avoided. Individuals with an allergy to ticagrelor or any component of the formulation should not take this medication. And individuals with active bleeds or history of intracranial bleeds, ticagrelor should not be used. Ticagrelor is also contraindicated in severe hepatic disease because it is metabolized by the liver. And use of ticagrelor is not recommended during pregnancy or breastfeeding because safety is not well established. Now let's explore precautions, situations where ticagrelor should be used with care. Ticagrelor has several drug interactions that may require dose adjustments or avoidance, so always consider a patient's medication list before prescribing. For individuals with a bleeding disorder, weigh the risks and benefits and monitor for signs of a bleed. Ticagrelor increases risk for hyperuricemia, or gout, so individuals with this condition should alert their healthcare provider if taking this medication. Ticagrelor is metabolized by the liver and excreted by the kidneys, so it should be used cautiously in individuals with moderate hepatic impairment or renal impairment. Awareness and understanding of these contraindications and precautions is important for safety and efficacy during the course of treatment.
Before we get into the nitty-gritty about Brilinta, let's start first with the P2Y12 receptor. Research starts with the endogenous P2Y12 receptor antagonist, adenosine triphosphate, or ATP. Using ATP as a starting point, another P2Y12 inhibitor called Cangrelor was discovered. This drug has an ultra-rapid half-life and is administered IV. Researchers shifted gears and focused on modifying the structure to make it more orally active, potent, and selective. If we ignore the phosphates in ATP for a second, we've just got adenosine. It's imperative to ticagrelor's development. Modifying the purine ring in adenosine increased affinity of the structure 100-fold, reflected in the core of ticagrelor. 3 nitrogens are found in that ring structure versus the 2 in adenosine. Additional hydrophobic substituents also increased affinity, mainly the phenylpropyl group, which increased affinity 10-fold. Now we're going to pass things off to Sora.
Hi, I'm Sora. Jumping right into the heart of our topic, the cost of ticagrelor. As of now, only Brilinta, developed by AstraZeneca, is available for purchase. But there's a light at the end of the tunnel. The FDA has given the nod to 2 generic versions in 2018 and 2023. The catch? They'll only hit the shelves after Brilinta's patent expires in 2024. So what does this mean for patients right now? They're shouldering the cost of brand name medication. Let's talk numbers. A 1-month supply of Brilinta, that's 60 tablets, can cost over $500. Even with a coupon, patients are still looking at around $450, breaking down to nearly $8 per tablet. But wait, there's a bit of relief in sight. AstraZeneca offers coupon cards for those with commercial insurance, slashing the cost to about $5 per month. Medicare Part D plan holders, they can expect to pay less than $45 monthly. Let's circle back to Claire for a moment as we delve into comparing ticagrelor with other medication in our next segments.
Looking at the structures of ticagrelor and clopidogrel, we can see that they are completely different. Though both are P2Y12 inhibitors, clopidogrel is unlike ticagrelor as it is a prodrug. They're metabolized by different enzymes, CYP3A4 for ticagrelor and CYP2C19 for clopidogrel. They also bind the receptor differently. Ticagrelor binds the receptor reversibly, which other P2Y12 inhibitors can't do. Looking at the research has shown for the first year after heart attack following stenting, ticagrelor is superior to clopidogrel as it achieved greater mean levels of platelet inhibition during maintenance therapy. Researchers also reported decreased incidence of sudden cardiovascular death. However, this benefit comes at the cost of higher bleed risk and the lack of a generic. Not all patients will be able to afford this medication.
And with that, another video comes to an end. Now you can be confident in your knowledge about this groundbreaking drug. We would like to thank Dr. Coons, Dr. Clarkson, Dr. Hannibal, Dean Seibert, and Pitt Pharmacy for giving us this awesome opportunity to share our knowledge with you. Hail to Pitt!